In 1998, in a response to the public outcry of HIV and AIDS,
Alameda County became the first county in the United States to ever declare a state of emergency in the African American community concerning HIV and AIDS transmissions.
And that state of emergency still exists today.
It's unacceptable. Overall, for the United States, HIV and AIDS infection rates have gone down.
However, there are disturbing trends in the Bay Area.
In Alameda County, we see new trends and new spikes in certain demographics,
especially in the African American communities. The communities that are most affected today are African Americans, women, and young MSM, both Latino and African American.
In Alameda County, the HIV rate for African Americans is 5 times higher than that of whites and Latinos.
African Americans represent 12% of the population, but they also constitute 46% of the new cases of HIV infections.
In San Francisco, African Americans represent less than 6% of the population, but are also representing 14% of those people living with HIV and AIDS.
African American women are disproportionately infected by HIV/AIDS. It's much higher than other groups such as white women.
Though the rates of HIV cases in women overall continue to decline throughout Alameda County, it is notable that in African American women, the rate of newly diagnosed cases of HIV is over 58%, and African Americans represent only 12% of the total population of Alameda County. There are a number of reasons that contribute to the high rate of infection in the Black community.
If you have issues of unemployment, if you have issues of low income and access to health care, and then there's the issue of education. And so those things combine to create a foundation of you being more at risk to contract HIV.
It has to do with the shame and the stigma around being HIV positive.
Homophobia is one of the biggest issues that we face. Mental health issues, depression.
Traditionally, the Black community does not talk openly about sex.
Sex education, sexual health in general, really is not at the level in schools that it needs to be.
The Black community was hesitant to accept that we were at risk, and because it started in the white gay community. And so with that knowledge, I think that people were comfortable with denial, saying that it couldn't affect us.
In the Black church, there are any number of issues, but the biggest one is the secrecy.
When it comes to our churches, that has been the place where African Americans have always went to for when problems arise, and the inability to be able to talk about the real issues have contributed to more African Americans dying.
What we need to do is look at how can we improve services, how can we address stigma and discrimination and make it a community issue and not stigmatize certain groups.
We need to start talking about HIV and AIDS in our homes, in our schools, and in our churches.
And also look at the structural issues. How can we get more support for programs in our community that address unemployment, that address lack of access to health care, that address looking at community services and community programs.
We can't remove pressure from our elected officials and those that represent us. It's important for them and it's important for our communities that they ensure legislation that fights and protects us and our children and those to come.
Well, the reality is that no one is going to come and save us. We have to step up, and BTAN is a response in the African American community to HIV and AIDS.
BTAN stands for the Black Treatment Advocates Network. It's a local initiative nationwide in multiple cities, which is coordinated by the Black AIDS Institute. Locally, BTAN is coordinated by the Bay Area State of Emergency Coalition, known as BASE. We work to inform, train, and connect AIDS service organizations working within the Black community, as well as advocates on the science and treatment of HIV and AIDS.
I believe an AIDS-free African American community is possible in the Bay Area.
It requires transparency, it requires trust, and it requires us getting together and uniting. If we allow the differences between sexual orientation and behavior to separate us, it will continue to divide us and eventually kill us.
It is a winnable war if we come together.